most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Hennig, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
You have dizziness? Answer this one simple question, and it can lead to a cure.
Oh.
And I'm not kidding.
Oh, say no more, Bob, and I know you're not.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And by God, it's your lucky day, because if you go to bobandbrad.com, go to the giveaway section. This week, we're giving away a knee glide.
Oh, yes.
Lightweight rehab device. Brad, do you want to show a little bit, or can't you reach the floor?
Well, I can reach the floor, Bob. I don't know if the camera can go
I'll
that low.
put it down like this. So if you go to Bob and Brad, go to the giveaway section, or go to Bob and Brad on Facebook. It'll be pinned to the top of the page, the contest that is. Go to Twitter, or Instagram, or TikTok if you want a 60-second version of our program. So
totally free.
Great device if you're having a knee replacement or preparing to have a knee replacement. Also, or if you're having any type of knee surgery.
Right.
Very, very helpful. All right. The most common cause of dizziness and vertigo is the spinning.
Sure.
Is actually what is called BPPV.
That's the abbreviation.
Yeah. And Brad and I don't know if we say this differently or not really. I think we say this close. Benign proximal positional vertigo.
Right.
And that's a mouthful, but if you have it, you've probably been diagnosed with it. You're probably very aware of what it is.
Oh, it's devastating. If you got a severe case, it puts you right out. You cannot function.
Right. So it's caused by loosened or displaced crystals in your inner ear. There's 3 canals in your inner ear, and you have it on both sides. 3 canals on each side. And those get loosened off, and they just throw your whole balance off, and they give you the spinning sensation and everything. So that's the most common cause of dizziness.
But it's not the only cause.
It's not the only cause. There's a lot of other things that could be causing it, but this is the most common cause. So there was a study that was just done. It was done by Ellen Lindell, and she's an ENT doctor, ear, nose, and throat. And she had 149 patients, 96 women, 53 men. They had dizziness. They answered 15 questions. And if they answered yes to this question, almost invariably they had BPPV.
So there was one question that they narrowed it down to.
Yeah, so if you're going to answer this question right now. Does lying down or turning in bed make you dizzy?
That's it.
That's it.
It's a yes or no question.
Yes. And if you write yes, there's a good chance you might have BPPV. Right. So this is going to want to go to your doctor and say, hey, do I have BPPV? What's nice about this one problem, it's the most common diagnosis, as I said, but it also is very treatable.
Without medication.
Without medication,
exactly.
Right.
And only with, a lot of times, one visit to the therapist.
Quite often I've done it with one visit.
And you can self-treat once you've been taught. Not everyone, but some people can. Depends on your ability and how mobile you are.
Right.
And how severe of a case you have.
So yeah, there's basically 3 types of BPPV. It depends on which canal it's in.
Sure.
So
we should clarify, because I think most people call BPPV vertigo.
Sure.
It's just it's
we'll
not really
vertigo.
Yeah, it's not technically correct, but that's what everyone calls it. Most people call it.
So the most common canal that you have with vertigo that is involved in the inner ear is the posterior canal. That's the one that's in the back.
Right.
85 to 90% of the cases of, I'm sorry, I got to say it one more time, BPPV are from the posterior canal.
Which is good news too, because it's not that hard to treat with positional treatment.
Yeah, we use the Epley maneuver. Now, if you want to, I'm going to show you one more test you can do to see if you have that canal involved.
Right.
Now, normally what we do, by the way, this may make the person sick, so you do want to have a bucket for nausea. I got my hat here, so if you want to throw up in that, Brad.
Yeah, it can get you, nausea, and then you spew. I've never had anybody do this in the clinic, but I've had people say they feel like it.
Oh, I've had people get close.
But not actually.
Not do it. No, never had
So that's good news.
So Brad, you want to sit, what you would do is, I guess you could actually do this on the floor, or you could do it on the bed. but you want to long sit, Brad?
Yep.
Yep, this way. So this is the starting position,
So this is long sitting with your legs out.
and it's again called the Dix-Hallpike maneuver. And what you're going to do, you want a couple pillows so that when Brad does lean back, his head's going to actually go into at least 20 degrees,
Can you see?
20 degrees of extension.
So
You probably
it's
don't
not
need
this far. It's,
right.
it's a little bit.
Yeah, so you probably wouldn't need this many pillows. You probably get by with one pillow. Brad.
Sure.
Why don't you go back now once here?
This particular technique usually is done by a therapist.
Yeah.
You may not feel comfortable doing this, and it's not
Right.
necessary.
This way you'll know what the doctor's doing to you or the therapist is doing to you. So what you do, I'm going to check it'd be your right side, Brad, first. So you're going to turn the head 45 degrees. That's halfway between all the way and
Right.
it's the starting point. 45 degrees, and then we take him down quite fast, actually. And I
Yeah.
hold on to his head. I'm not going to hold on to your head, Brad. Why don't you go ahead and go back?
Right. It'll interrupt with my
Yeah.
mic, and
Microphone.
I don't like him holding on to my head anyways. So yeah, so it's back here, and it is pretty quick, and then
Yeah.
I'm back like this. And with the therapist holding on your head, it feels more comfortable.
supported.
Mhm.
And the thing is, what often is the eyes start moving. Now they might go up and down, they might go side to side.
The nystagmus.
Nystagmus.
Is
So that kind of gives a clue where what canal it's involved.
Right.
And I mean, it's definitely going to bring on symptoms, and the symptoms usually go away after about 60 seconds or less. And it might make you nauseated.
In the clinic, they'll oftentimes put on these glasses
Yeah.
that blow up your eyes, so it's easier to see
They'll
the eye
see it on a
movement.
screen.
Yeah.
Right.
Mhm.
So, Brad, that would be checking the right side. For the left side, you turn 45 degrees that way and go in, again, 20 degrees of extension. So that's another test. If that's the gold standard for me. Like if that's positive, then we're going to go ahead and do what is called the Epley maneuver.
Sure.
Look it up. Go to Bob and Brad on YouTube, our channel, and then just type in Epley, E-P-L-E-Y. And that'll give you to the maneuver. We'll show you.
We actually have 2 videos on the Epley.
Sure.
An updated one.
We did one on a live patient.
Oh, yeah.
Remember
That's
that was
right, yeah.
one of our office aides, and she had a pretty severe case, and she was one of those that just magically one treatment took care of it.
I would
So-
say 80% of my cases, one treatment.
I've had some recently.
You had some come back?
Yeah,
for
recently.
second?
Recently I haven't been having as much luck. In fact, a lot of times I'll do it several times the first time even,
Right. Yeah.
and then I did it several times, and then I had to repeat it even.
Have you had any patients that wanted to actually do it themselves? Say, I think I can do this myself. And
No, the ones I've had lately have been very elderly.
Sure.
In fact, I almost need 2 people even to do it with them because
Okay.
they don't turn very
then,
easily.
right, yeah.
While you're turning and stuff with the Epley maneuver, you worry that they might roll off the bed, and
Sure. Mhm.
it's fairly simple, but it involves a lot of turns and such,
Yeah.
but it can be very dramatic how well it works.
Yeah.
I mean,
Right.
So-
It's so much better than other options. I
Yeah.
think it's very simple,
all right. Remember, Brad and I can fix just about anything.
except for,
A broken heart, but we're working on it day and night.
and we won't stop until we get there.
Yeah.
Well, we'll take a rest.
All right. Thanks for watching.